Thanks for coming. Tonight I'm going to talk about what a stroke is, or on strokes. What is a stroke? A stroke occurs when blood clot blocks an artery or a blood vessel breaks, interrupting blood flow to an area of the brain. When either of these things happen, brain cells begin to die and brain damage occurs. When brain cells die during a stroke, abilities controlled by that area of the brain are lost. These abilities include speech, movement, and memory. How a stroke patient is affected depends on where the stroke occurs in the brain and how much the brain is damaged. There are two types of strokes possible. Don and Fisher, McLeod and Davis, 2008, in The Lancet, explain that ischemic strokes are the most common type. Ischemic strokes occur when a blood clot forms in an artery that supplies the brain with blood. The other type of stroke is called the hemorrhagic stroke. These occur when an artery that supplies blood to the brain develops a tear or ruptures, allowing blood to leak into surrounding tissue. Now I'm going to explain the risk factors. There's controllable risk factors and there's uncontrollable risk factors. The controllable risk factors are high blood pressure, high cholesterol, diabetes, circulation problems, tobacco use and smoking, alcohol use, physical inactivity, and obesity. Then there's, of course, the uncontrollable risk factors, which is age, gender, race, family history, and previous stroke. I'm going to go a little bit over the uncontrollable risk factors. Age. After age 55, the risk of a stroke doubles with each decade. So the older you get, it's bad. Gender. Women are most likely to suffer a stroke than men. Sorry, ladies. Race. African Americans are twice as likely as whites to have a stroke. Family history. Stroke risk is greater in individuals who have close relatives than have had strokes. And of course, previous strokes will raise the risk of a second stroke. So how do we detect these symptoms? There's an acronym that is used called FACE, or called FAST, Face, arms, speech, and time. Face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms out. Does the arm drift downwards? Speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? And then time. If any of these symptoms are observed, call 911. It is very important to get to the hospital within 3 hours of the stroke. Now note, the reason why it's important to get there 3 hours before the stroke, if given with 3 hours of the first symptom, there's a clot buster medication that may reduce long-term disability for the most common type of stroke. So it's very important to get there within 3 hours of having a stroke. Now I'm going to show you a little clip on a life of a stroke.
Mark had a debilitating stroke in 2002.
I went down, took a shower, got out of the shower, and that's the last thing I remember.
She had to learn to walk again and talk again. Nowadays, she finds herself navigating a new reality. Marge battled depression and met with a counselor.
And he said, there's always people worse than you, but it was just words. So when I came here, I realized that I'm not so bad.
She finds comfort among other stroke survivors. As death rates for stroke have dropped significantly, it means there are more survivors than ever before. An estimated 7 million people living with the after effects. Sarah Simon oversees a stroke support group at the Wellness Center of Cape Coral.
Usually we'll kind of go around and everybody will have they'll share the success that they've had that week, like if they've had a little bit of progress in their recovery, they like to talk about that. They also talk about what things work for them, like if they have trouble doing, getting dressed or sleeping or something like that, they'll say, well, this is what I do that helps me.
A good attitude and companionship helps ongoing recovery.
And we have lots of laughs.
And creates a lifeline for survivors to hang on to. For Lee Memorial Health System, I'm Amy Osher.
So in short, to treat the treatment, thrombolytic drugs helps reestablish blood flow to the brain by dissolving clots, which are blocking the flow. And then, of course, rehabilitation. Rehab begins usually as soon as possible after the stroke. This takes place either in the hospital or at a rehabilitation center. In conclusion, as explained in the writings of Muir 2002, improving recognition in response to the onset of stroke, a stroke can also be called a brain attack. A stroke occurs when the blood flow to a part of the brain is interrupted by a blocked or broken blood vessel. Stroke is one of the leading causes of death and disability. It is imperative for victims of stroke to retrieve medical assistance within the first 3 hours of onset of stroke symptoms. And always remember the acronym FAST: face, arms, speech, and time. Thank you.
Did I get myself?
That's fine.